So I'm going to start with the anastomosis within or at the elbow joint, or just elbow, or at the elbow joint. This can be asked either for 5 markers, or also it can be asked for the 3 markers. So I want you guys to remember two important things that are related to the anastomosis. So it is the collateral, and one more is the recurrent. So we are going to see what is collateral and what is recurrent. So arteries, they are represented with the red color in the textbooks, and while writing in the exams you have to draw it with the red color. So yeah, collateral, what does collateral mean? Just remember, parallel or lateral, it is called as a collateral. So this is the main artery, and if the branches of this artery are in this direction, they are parallel to each other. So look, this is parallel and also this is parallel, so this is the parallel, it will be called as the collateral artery. And for the recurrent, the blood flow will be in the downward direction. So if the arteries are going in the upward direction, it is going to cause recurrention of the blood, so it is called the recurrent arteries. So just remember the difference between the collateral and the recurrent. Just remember, collateral means parallel and recurrent means opposite in direction. Okay, and these diagrams will be really important to know. And now we are going to start the anastomosis around the elbow joint. I'm going to use a darker shade. So here we are going to first draw the humerus. So suppose this is the humerus bone, and this one is the radial bone, and this one is the ulnar bone, and this is the elbow joint. So now I'm going to label it. So these are the supracondylar regions. These are the supracondylar regions of the humerus, and these are the condylar regions of the humerus. And just know that this is the medial side that we are talking about, and here it is the lateral side. Okay, so this is the lateral side and this is the medial side. All of us know that on the medial side, the bone that lies is the ulnar bone or the ulna bone, and on the lateral side, it is the radial bone or the radius bone. Okay, so now we all know that the artery that is in the upper in the arm, it is the brachial artery. So this is the brachial artery. Okay, so this is the brachial artery, and it gets divided into two arteries, that is the radial artery at the radius side and ulnar artery at the ulnar side. So this is very important to know, and let us name it. I'm not gonna write the names, that is, it is going to consume a lot of time. I'm just going to write BA, that is the brachial artery, UA, that is the ulnar artery, and RA, that is the radial artery. Okay, now we are going to study the branches of this brachial artery. So the branches of the brachial artery, it gives off one deep branch. All of us know that the deep meaning, the name that is used deep in biology is the profunda. So it is coming from the brachial artery, so it is called as the profunda brachial artery, and it gives off two branches. One is the posterior branch and another one is the normal anterior branch. Okay, this one dotted represents the posterior profunda brachial artery, and this one is the anterior profunda brachial artery. Okay, so now coming to the on the medial side, it gives of two branches. One is the superior, and it is on the ulnar side, so it is called as the superior ulnar collateral artery. Why collateral? I already explained it here. Why is it collateral? Right, because it is parallel to the main artery, main brachial artery, it is parallel to it, so it is called as the superior ulnar collateral artery. And just below it is one more collateral artery at the ulnar side, it is inferior to the superior, so it is the inferior ulnar collateral artery. Okay, now the radial artery, it gives off two branches. One is the it is going in the upward direction, so it is the radial anterior radial recurrent artery, and it gives one more branch, that is dotted line. What does it represent? It represents the posterior side, right? So it is the posterior radial recurrent artery. Okay, posterior radial recurrent artery. The ulna gives off two branches again. That one is the posterior, this one is the posterior, it is going opposite direction, so it is called as the posterior ulnar recurrent artery. And one more is the anterior, so it goes the anterior ulnar recurrent artery. All right, now the ulnar, it gives two more branches at this place, so it is the common place, and it gives of two branches. One is the anterior portion and another is the posterior portion. It is emerging from a point, a common point, so it is called as the common interosseous ulnar artery. Okay, common interosseous ulnar artery. This is the anterior ulnar interosseous artery. This is the posterior ulnar interosseous artery. Okay, now I want to tell you guys that there are four anastomoses. Okay, there are four anastomoses around the elbow joint. Okay, first one is between the anterior and the anterior, so this is one anastomosis. Second one is again the anterior and the anterior, and one more is the posterior and the posterior. Okay, I forgot to tell you guys that this is also a posterior. Let me dot it out. So this is also a posterior. All right, and then it goes here at the three anastomoses are happen, and now the fourth anastomosis is between this and this, so it is going to be like this. It is really thick. It is going from the lateral side or the medial side, or you can just say it is going from the medial side to the lateral side. So there are four anastomoses that I want to highlight about. So the first one is here, the second one is here, the third one is at this point, and the fourth one is at this point. So these are the four anastomoses around the elbow joint. Now I'm going to name the anastomoses, so make sure you see them. So first one is between this is the anterior profunda brachial artery and the anterior radial recurrent artery. So this is the first anastomosis. The second anastomosis is between these two, so this is the inferior ulnar collateral artery and the posterior ulnar recurrent artery. The third one is going to be the superior ulnar collateral artery, and then the last one, that is the anterior ulnar recurrent artery. And the fourth one is the fourth anastomosis, that is going from the medial side to the lateral side. It is the posterior ulnar interosseous artery and the posterior profundi brachial artery. Okay, this is a box that you must remember. Okay, this is going to be very important for the thing. So this is the anastomosis around the elbow joint.